Aprilia Novita Indrawati. I am from Polytechnic Catholic Mangunwijaya. I want answer question from case study 12, forced treatment of the mentally ill. Before I answer question from case study 12, I want to read the cases. Let's go. Case study 12, forced treatment of the mentally ill. Mr. Mr., Mrs. FZ, and Mrs. FG had been involuntarily committed to a psychiatric center. It was being retained pursuant to orders of the local court, which had found them to be persons in need of involuntary care and treatment, in that they have a mental illness, for which care and treatment as a patient in a hospital is essential to their welfare, and their judgment is so impaired that they are unable to understand the need for such care and treatment. These patients refuse to be medicated with antipsychotic drugs. Their objections were overlaid, and they were subsequently medicated with various antipsychotic drugs. Mr. Mr. and Miss FZ thereafter commenced a declaratory judgment action against the commissioner and officials of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and a declaration of their common law and unconstitutional right to refuse medication. Mrs. FG refused treatment with antipsychotic drugs, but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violates her common law and constitutional right to determine her own course of treatment. Question from the case is, should the hospital allow mentally ill patients to determine their own course of treatment? If you answer yes, every individual of adult years and sound mind has the right to determine the course of his medical treatment. This fundamental right is extensive to mentally ill patients. The fact that patients at a state facility are mentally ill or have been involuntarily committed does not constitute a sufficient basis to conclude that they lack the mental capacity to comprehend the consequence of their decision to refuse medication and to understand that their refusal poses a significant risk to their physical well-being. If you answer no, the right to reject treatment defies to patients of sound mind. The above mentioned patients seem to be impaired and to lack the capacity to make a rational decision with respect to proposed treatment. Moreover, these patients cannot determine the course of their treatment, and they should be treated with antipsychotic drugs for their best interests. From this case, my answer is no. The right to reject treatment refers to patients of sound mind. The above mentioned patients seem to be impaired and to lack the capacity to make a rational decision with respect to proposed treatment. Moreover, these patients cannot determine the course of their treatment, and they should be treated with antipsychotic drugs for their best interests. This is my answer, and thank you for watching, and goodbye.